Well, hello, everybody. Thanks again for joining us for another webinar for High Plains Health Plan. This is the second webinar we're going to get conducted and underway today. We appreciate everybody attending, and if you couldn't make it live, no problem. We started recording, and these things will be posted on the High Plains Health Plan member portal, which is what our topic is today. Before we get into today's topic, which is going to be our navigating the member portal, we've created a specific web page for all plan members of High Plains Health Plan that I'm excited to show you today, and then also talk to you about how to use some of the features within that member portal, and then some other announcements on our concierge services. Everybody likes to have concierge services. Nobody likes to wait on hold. Nobody likes to navigate 50 different websites to find answers to their questions. And so today we're going to be talking about the internal services that we provide to High Plains Health Plan members with phone calls and web connections and the website. And I'm excited to tell you that. A recap real quick of last month's webinar, which is also available on demand on the member site, was about the Tier 1 and the Tier 2 networks, the difference between the Tier 1 and the Tier 2 networks. If you haven't had a chance to view that webinar, you don't have to watch these in any particular order, but that one was pretty important too, because anytime, as a reminder, in High Plains Health Plan, when you go to a Tier 1 provider, you're going to save a good amount of money. And so today we're going to keep this brief, just like we did the very first webinar. I want to keep these brief. We will have a Q&A session at the end. Just use the functionality there as a webinar attendee to use the Q&A button, and you can it comes to me here and I can answer them live, and then it'll also be available for the recordings. But thanks once again. I hope everybody has a great Halloween coming up. The weather's getting cooler, and we're going to continue these webinars every month to make sure that you have access to information anytime you need it. I'm going to do a quick screen share of the website, and then we'll get started on the member sheet. But let me go ahead and do that and do a screen share here. All right. Everybody should be able to see, you know, my homepage and everything of High Plains Health Plan. As a real quick reminder, don't forget about the directory under Find a Doctor. It's an extremely valuable resource for you as a covered member under High Plains Health Plan to be able to quickly search if your doctors are in our Tier 1 network or if they're in the Tier 2 Aetna network. And so this directory through High Plains Health Plan website is the Tier 1 directory. You can search by doctor name. You can set a radius of your zip code to see how many doctors are near your location. And I've got an announcement here in just a few minutes that we're going to be sharing that we're really excited that we can start to announce some additional additions to the Tier 1 network. We'll get to that here in a few minutes, but just keep in mind, remember that on the main page, up on the main tabs up here under Find a Doctor, you're able to see all of our facilities and physicians that are in the Tier 1 network. And as we develop the Tier 1 network and make it broader for you as members, we always send out email communications. And so early next week, be expecting an email from High Plains Health Plan that is going to announce you know, some additions to the Tier 1 network. But since you're on the webinar today, you're going to get that information a little bit in advance. So, but just a reminder here from the homepage. Another thing I want to point out that's relevant to today's webinar topic is you'll notice that we do not have a button on the main page of High Plains Health Plan specifically for members. And that's okay. We don't want to put it up here and make this member portal accessible to the general public. So I'm going to switch over to this screen, and you can see that everything is still branded. You can go back to the main pages, but you need to jot down this this address right here, and I'm going to also place it in the chat. It's hphealthplan.com/members. Okay, so there's the link in the chat for you to quickly access this. If you want to save this page as a favorite, that's great, because this is the stuff that you're going to really want to access as a member, as a covered member of High Plains Health Plan, and that's where we're going to kind of start out today and address this. So the first thing you'll see is it says, let's get you what you need. Okay. And that could be a lot of things to a lot of people. Maybe you need help with scheduling a doctor's appointment. Maybe you need to get into a doctor a little bit more quickly, but they're telling you it might be 2 to 3 weeks. These are situations we can assist with. Okay. The other thing may be, hey, I lost my ID card and I need to request another one, or I want to track the progress of a claim. I want to see how much of my deductible I've accumulated. I remember that if I need an MRI or a CT scan or a sonogram or something like that, that there's people that can help me get to a facility to get an MRI and it doesn't cost me anything. These are all examples of and reasons why people should reach out to us and to High Plains Health Plan. We're here as advocates and concierge supporters to help you navigate your benefits. And when you do, you're always financially rewarded, especially in that tier 1 network with $0 deductibles and $0 copays. So we're going to use some examples. If anybody has specific examples why they would that they would like to discuss with us, this is why we've created the member page and also the concierge line. So when it comes to getting you what you need, this is one thing that we sent out an email to all High Plains Health Plan members a couple of weeks ago, announcing that we launched this concierge member advocacy service. Now, I want everybody to know this is my staff, this is me included here at Butler Benefits and Consulting. We are the folks that are going to be answering when you call this number, 806-510-HPHP or 4747 on your keypad or on your touch tone phone there. And so we urge you and we encourage you to call us for more urgent matters. If you're at a doctor's office and they're saying, hey, we don't take this, pick up the phone, call this number, 806-510-HPHP, and we are happy to troubleshoot things in real time with you or for providers or anything like that. If you want to have a personal conversation about a private matter involving your benefits or anything like that, call this number and our teams are here. Now, this number is not available 24/7 right now, okay? So it's only available to talk to a person live during our business hours, which are Monday through Friday, 8 a.m. to 5 p.m. So if it's something that's on the weekend, we've got other avenues for that, and I'm going to get to that here in a second. But program this phone number in your phone, okay? If you need services to help you navigate your benefits and navigate your healthcare services, we're here to help you seek high quality, low cost providers. Okay, so there's some other self-service. That's the first thing. Just remember, we're always going to reference this concierge member advocacy feature that if you need to contact us, that's one way to contact us directly here at High Plains Health Plan. Then there's some self-service types of features that I've built into this platform for you as well. And the first one is this benefits portal. You can enroll in benefit. You can access. This is Employee Navigator. So when you guys will see this, when you click on this, it's going to take you over to the login for Employee Navigator. Now, this is the tool, ladies and gentlemen, that y'all all know that we use at open enrollment time, where you log in and you're making all of your elections for Employee Navigator. So there is a link on the member portal to go directly into Employee Navigator. Now, why would you want to go into Employee Navigator? Well, because that's where we have all of the documents housed for your plan, your summary of benefits, all kinds of things that if you want to learn about green imaging, if you want to learn about any of the tier 1 providers, all of that information is stored in your Employee Navigator profile. So again, this would take you directly over to the login screen for Employee Navigator. So it's a way for you to access eNav. Okay, the second one is a link directly to Lucent Health. Now remember, Lucent Health is your third-party administrator. They are the TPA for High Plains Health Plan. And if you have not already established a direct account with Lucent Health, we encourage you to do that. And you can do that when you click on this link right here. It'll take you to Lucent and it'll have login instructions. If you've already created these login credentials, that's great. Just log in and you know how to use Lucent's portal. This is for if the reasons you would want to set up an account with Lucent Health. They store your medical ID cards electronically. So if you lose an ID card, you can access it right here directly. You can pull your own EOBs, your explanation of benefits, and this is going to be a specific webinar topic in the future. So I'm going to kind of cover it today at a high level. But there's a lot of things. If you want to track a claim, if you want to order a new ID card, all of that kind of stuff can be done directly in the Lucent Health portal. Now, if you don't know how to set up your Lucent portal, here are the instructions. So right below, you can download the instructions and just follow these instructions to set up your account directly with your third-party administrator, which is Lucent Health. It's taken a minute to load, but there it comes. And it's got all your good instructions here on how to establish that login credentials directly with Lucent Health. All right. If you're having trouble with it, give us a shout. We're happy to kind of troubleshoot it with you as well. So that's the Cypress login, or Lucent Health login. Okay. Obviously, this was the topic we covered last month, finding a tier 1 or tier 2 provider. That's obviously going to link you right back to that directory that I just gave you a recap on. It just links you right back over to our Find a Doctor or our provider directory for you to be able to locate tier 1 and tier 2 providers. As we're adding new providers and physicians and facilities to our tier 1 network, they're being loaded into this directory, and we update that periodically to keep it updated for you throughout the year. It's very important that you know who's in your tier 1 and tier 2. So there's a link to that here as well. All of these webinars that we're hosting once a month, where we're doing deeper dives into your benefits and how to use High Plains Health Plan to your advantage and to how to maximize your benefits. These videos that we're doing right now, these webinars are being recorded. And so this is where we're housing that. We've started a specific page for webinars. Here you can see is the webinar from last month, where we took a closer look at your tier 1 and tier 2 networks and how your benefits work with those two networks. Feel free to go back and watch that if you haven't. Really, really valuable information there. And going forward, all of our webinars are going to be housed here in your member site, right here where you can watch High Plains Health Plan educational webinars on demand. Okay. The last thing that we're really cool, that's really cool in our opinion, that we're excited about, there is an embedded benefit within High Plains Health Plan called Global RX Manage. As many of you know, we talk about this in your open enrollment meetings and at orientations and things of that nature, is our ability to purchase medications from other countries, sometimes at a fraction of what those same medications cost in the US. And so this is a very, very valuable tool for High Plains Health Plan members, that if you're taking medications, prescriptions, I highly encourage you to go to this link right here, which is a comprehensive list of all of the medications that we can purchase from Canada or New Zealand or the United Kingdom, England. And we also give you the prices. So you can go and you can compare the actual prices of these drugs that we are purchasing through your plan in the United States versus what we can purchase them in other countries. And I'm going to go real quickly to GoodRx, and I'm just going to give a good example. So GoodRx pricing is pretty close to the pricing through your health insurance. So if you're using the health plan, and then this is about what the price of the medication is going to be. So I'm going to use a drug named Enbrel. It's a very expensive medication here in the US. As you can see, even through GoodRx, we'll just go and we'll look at the 50 milligrams. You can see that this drug is right around $7,000 a month at most pharmacies in the US. That's extremely expensive. It's $85,000 a year. Now, you're not paying $85,000 a year. You may just be paying a copay for your Enbrel, but your self-funded plan, right? Your employer is self-funded. You guys are self-funded, right? They're the ones paying the difference. The plan, that's your money. It's not just employer money. That's also your money. Okay, you got to ingrain that in your head, that these are the prices you guys are collectively paying for Enbrel to be filled through a pharmacy in the United States. So when we go back over here and we take a look, this is a very long list of medications that we can procure from other countries. So if you just want to use the search functionality by hitting Control F, it'll pull up. So you can just narrow this down and go directly to Enbrel. Now, guys, take a look. That same 50 milligrams of Enbrel that we can purchase either from Canada or New Zealand or England or what we deem a tier 1 nation, we can purchase that drug for $2,664 a month versus $7,289 a month through Walmart Pharmacy, or $72.83 through Walgreens, or $72.40 through CVS, right? Guys, that is a massive difference. It's almost a $60,000 a year difference that I'm saving you. And because you got to remember, as a self-funded employer, this is not just your employer's money that's paying for these medications. It's your money. They're withholding money out of your paychecks on a per paycheck basis, a monthly basis, or a weekly basis, or a semi-monthly basis. And that money's going into your plan to pay for these medications, right? And so why would we go pay $7,289 for a medication that I can help you and your company purchase for $2,664 a month? That's almost a $5,000 a month difference. Guys, that's substantial savings. So on your member portal, this link that's called International Prescription List with Prices is this international list right here. I really encourage you, if you're taking high-cost medications, there are programs baked into High Plains Health Plan to help you access the same medications, but we can pay extremely lower prices for in a lot of cases, okay? If your drug's not on this list, well, then maybe I can't secure it internationally. And I'll give an example. If you take a controlled substance like a painkiller, would be, in order to ship a controlled substance from a foreign country into the U.S. is a violation. That's a federal violation. You can't ship narcotics or controlled substances from one country into another country. So you won't find oxycodone or hydrocodone or any like painkillers or anything that's deemed a controlled substance, Adderall. You won't find those types of medications on this list because that would be a federal violation. But if they're on this list, we want to talk to you. We want you to reach out to us. Our objective and goal is to get you the quality care that you need, including your prescription drugs. But if we have avenues where we can pay $2,600 a month for that drug versus $7,200 a month for that drug, then that's what we're hired to do, is to be proactive and help you save money and get the care that you need. So that's on this international drug list, guys, that I could give you. Literally, you can see how comprehensive it is, and it gives a lot of information. So like Advair HFA, there's different dosages and quantity limits and different prices. So you can match your specific prescription, your dosage, your frequency, and your price. And you can compare these prices to GoodRx, just like I just showed you, and you're going to see how much price difference there is when we can access these types of strategies versus just blindly using the insurance and overpaying for healthcare services and prescriptions. We're really excited about this partnership and this benefit within High Plains Health Plan. The last thing I'll say about that international program, this program that we're looking at the pricing, when you use that international sourcing strategy, you don't pay anything. It's 100% covered under High Plains Health Plan. It eliminates your out-of-pocket. It eliminates your copays. You don't pay for shipping. Yes, these drugs are mailed to you. They're shipped to you via mail order from an international pharmacy that's filling the medication. You receive it in the mail timely, and you don't pay anything for that program, not even shipping. Your plan covers it at 100%. So extremely beneficial links. These are all like self-service links. You can come here anytime to hphealthplan.com/members. You can access these links right here anytime. Okay. Now, if you have I'm going to move on to the next thing on the member site. If you have more of a non-urgent, request or question, or you need to visit with us about an upcoming surgery or an upcoming MRI that you need, you don't necessarily have to call the concierge line. We want to kind of reserve this line for more urgent services. But if you have something that's on the horizon, or like say it's a surgery and you know like, oh, I want to make sure that I'm using a tier 1 provider so I can eliminate my deductible, then we've also created a form down here. And it's real simple. Everybody knows how to complete these online forms. I'll give you an example. You just put in your name, put in your email and a phone number, and then tell us, do you prefer us to email you back? Or do you want somebody here at High Plains to give you a call? So just say, yeah, I want you to call me. And then if you don't mind, please just put in, the name of the employer that you're, because we want to know which, we have multiple employers that are participating in High Plains Health Plan. So just let us know where you work. And then if you say, what $0 service are you looking for today? And like I said, what if it's an MRI that your doctor says, hey, you're going to need to have an MRI? You could come here, you could fill out the top half of the form and just say, I need help and some assistance scheduling an MRI. Just check the box and you can come down here and say, give me a little note. Saw my doc and I need an MRI. Can you help? And then all you have to do, you can say whatever you want, just write us a brief little note and then hit submit. When you click submit, that comes right here to my staff at Butler Benefits and High Plains Health Plan. And we've got dedicated people that, that monitor this throughout the day, that get email notifications. When you send us this form, we're notified here and we're going to reach out to you. You said you wanted a phone call. So if you put your phone number in, expect a call from us. We're going to call you. And then we're going to say, hey, you said you needed help getting an MRI set up. Great. Here's what we're going to hold your hand. That's why we call this a concierge service. We're here to help you navigate your networks, to utilize your benefits, and to maximize the value of High Plains Health Plan. And so you have multiple ways to do that. Okay, so we feel like this is, please use the form if it's like non-urgent. If it's urgent, pick up the phone and call the 510 HPHP. If it's not urgent, then fill out the form and expect someone from our firm and our organization to be reaching out to you within 24 hours. Okay, and we'll reach out and we'll assist you in whatever needs you may have. So that's the topic this month. I'm going to pause for just a few minutes. There's a few people on the webinar today, and so I'm going to stop my screen share for a moment and just give everybody a moment to kind of catch up and digest and see if anybody has any questions. And if not, we're going to give you some time back on this Friday and let you get on about your weekend, but I'll pause for a minute and see if there's any Q&A. Okay, great, guys. I'm not getting any questions coming in today, which is just fine. You can always ask questions through the member portal. You can call the number, here that we provided if you have anything specifically you'd like to discuss with us. But I'd like to thank you once again. Thank your employers when you see them for participating and making a decision to participate in High Plains Health Plan. Our goal and our mission is to get you the highest quality healthcare services that we can at a $0 cost for you if it's possible, or a lower cost, at a fairer price. And that's really the key objective, is lowering your costs, lowering your out-of-pocket costs without skimping on the quality of healthcare that you're receiving. So once again, thanks again. You guys have a great weekend, and we'll see you on the next webinar.